Hi, this is Keith. This is the lecture for Chapter 5. If you haven't read that chapter yet, it's a good idea to do that first and then listen to this lecture. So, in this lecture, you'll learn about studying gender, gender roles and sexuality, gender role learning, contemporary gender roles and scripts, and then we'll end with a discussion of gender diversity. Why do we study gender, gender roles, and sexuality? Well, importantly, they are defining characteristics in our society. Think of all the ways that we think of something as male or female, or what behaviors are considered masculine or feminine. For example, when I say the word emotional, would you say that this is more male or female? Or when I say someone is a member of the police force, what image comes to mind? Of course, all people can be emotional and anyone can be a member of the police force, but our culture tends to accentuate or invent psychological, emotional, mental, and behavioral differences between men and women. Other examples include the way that different products are made for women compared to men, or the way that we attribute raised and assertive voices in female politicians compared to male politicians. In this presentation, we'll explore this phenomena. But first, let's make sure we understand some basic definitions. These will be important to tease out biology from culture and society. We experience issues around sex and gender from the time we're born. While some states allow for biological sex to be undefined at birth, most states and most newborns are assigned female at birth or assigned male at birth, usually based on their external genital anatomy, but sometimes based on internal gonads, chromosomes, and hormone levels. Typically, a physician will assign a newborn female or male at birth. More broadly, sex consists of a set of biological attributes in humans primarily associated with physiological and reproductive features. This is why we associate sex with being male or female. In contrast, man or woman is used when we're referring to gender, which we'll talk about in just a bit. But even when we break down sex, it has different elements. Genetic sex is one's chromosomal and hormonal sex characteristics, such as whether one's chromosomes are XX or XY, or whether estrogen or testosterone dominates. In contrast, anatomical sex is the physical manifestation of genetic sex. Anatomical sex is determined by whether we have gonads, a uterus, a vulva, vagina, penis, and so on. Although sex and gender are often used interchangeably, gender is not the same as biological sex. So gender refers to the socially constructed roles, behaviors, expressions, and identities of girls, women, boys, men, and gender diverse people, including the norms that a given culture associates with a person's biological sex. So gender is a much more encompassing term that goes beyond anatomy and physiology. In sum, sex is rooted in biology, while gender also considers the role of culture and socialization. Once gender is assigned, that's when our ideas about the attitudes, behaviors, rights, and responsibilities associated with each sex, which are collectively known as gender roles, begin to exert their influence. Even just saying, it's a girl or it's a boy brings along with it a lot of cultural meaning and expectations about what that infant will be like. And it's these gender role stereotypes that can often lead to conflicting ideas about how each gender should behave. Gender role stereotypes tend to be rigid and generalized to all persons who are perceived to be one gender or another. So even if we ourselves do not ascribe to rigid gender roles, most of us can certainly say what those gender roles tend to be in our society. They sort of permeate everything. Those stereotypes also can be false or misleading and could have implications for what opportunities people might have in our society. For example, if a role stereotype for girls is that they are not supposed to enjoy math, then those stereotypes might encourage some people to avoid certain fields like mathematics or science. So gender role stereotypes can have real-world implications. It's important to note that in the science of the study of gender roles, it may be that there are statistically significant differences between genders for a given behavior or attitude. However, Importantly, group averages are not good at predicting the reality for a specific individual. So when we find differences in a behavior or attitude by a group of men versus a group of women, being able to say that a particular individual in either group will behave in that way is really difficult to predict. Okay, so how do sex and gender interact with each other? They come together in a person's gender identity, or a person's internal experience of gender. So each of us carries a sense of our own gender identity, even though we may not realize it, because it's so much a part of who we are. Someone whose gender matches their biological sex assigned at birth has a cisgender identity. For example, I was assigned male at birth and identify as a man, so my gender identity is cisgender. Someone who is assigned female at birth and whose gender identity is as a woman is also cisgender. Our culture tends to emphasize two genders, namely as a man or a woman, which align with biological sex of male or female. And this is what we refer to as the gender binary. As we discussed earlier, assigned gender is based on anatomical appearance at birth. This anatomical appearance is a cue to other people about how to respond to us from an early age. So if someone's assigned gender is female, an adult might say, "Oh, what a sweet princess." In contrast, if someone's assigned gender is male, an adult might say to a newborn, "Oh, he looks like a real bruiser." But we now know that from more recent scientific studies and from shifts in cultural awareness, that there are a lot of people who do not fit the gender binary. So there are a lot of different terms for this diversity in gender, such as terms like gender variant, gender non-binary, gender queer, or gender non-conforming, or gender expansive. Gender can be quite nuanced, which requires us to sort of find some comfort with that nuance. It can include people who identify as agender, which are people who do not identify with any gender, or people who are gender fluid, whose gender is not static and may change over time or depending on the context. A term that most of us probably have heard of is transgender, which is a fairly broad term to mean persons whose gender is not congruent with sex assigned at birth. So someone who is assigned female sex at birth and whose gender is as a man may identify as transgender. But just keep in mind, in this example, while we might say that this person falls under the transgender umbrella for scientific purposes or by this definition, this person may identify personally as a transgender man or simply as a man or have a different gender identity. And that's why it's easiest and best to ask what a person's gender is, since it may or may not be what we think it is. As we've been talking about, culture plays an important role in gender roles. Cultural norms fluctuate and change with time and across cultures. For example, among the Arapesh of New Guinea, both sexes have what we consider feminine traits, and both genders are said to bear a child. Nearby, the Mundagumor of New Guinea believe that both sexes exhibit what we might consider masculine traits. So men and women are expected to be violent, aggressively sex, and fight. Now, these cultural differences will, of course, impact children's understanding of gender through their developmental years. And as many of us are aware of, in a traditional Western view, men and women are seen as polar opposites of each other. So men are thought to be aggressive while women are passive. Women are believed to be nurturing while men are distant. So in this view, men embody instrumentality and are task-oriented. In this view, men are rational and define a relationship by sex. In contrast, women are seen to embody expressiveness and are emotion-oriented. In this view, then, women are irrational and define a relationship by the feeling of love. Gender stereotypes have changed, however, over time, and this is due to a large number of factors, but this can include shifts in women's roles in the workplace, movements for women to have equal rights as men, and cultural shifts in attitudes towards gender. Now, in broad strokes, the biggest change has been that stereotypes of female gender roles have become more fluid. However, men's gender roles really haven't budged much. But we still have a ways to go. Sexism and misogyny are so common and have important negative consequences in our society. By sexism, we mean the discrimination against people based on their sex rather than individual merits. Sexism is often associated with gender stereotypes. So the stereotype that women are not interested in math or science may lead to instructors to not give female students attention during these classes, and guidance counselors may discourage them from studying math at college. Sexist attitudes have long-term consequences, such as preventing individuals, especially men, from expressing their full range of emotions, or preventing individuals from seeking out certain vocations. A particularly insidious form of sexism is misogyny, which is a form of prejudice that involves the hatred or disdain for women. We only have to watch the news or read the newspaper to see the various forms that misogyny has taken today, from vilifying women who seek political office to sexual crimes committed against women. So we have a long way to go to fully address these problems. Now, it's important to make a distinction between gender and sexual orientation. Many people see gender identity, and gender roles as closely related to sexual orientation, which, as you know, is about who somebody is sexually attracted to. This assumption is, for example, that masculine men are attracted to women. Within this assumption is that gay men, because they are not attracted to women, are not masculine, and that gay men must have feminine characteristics. Seen through this lens, then, homosexuality is associated with a failure to fill traditional gender roles. Now, these types of beliefs reflect a bias towards heteronormativity or heterocentrism, which is the position that people fall into distinct genders with natural roles and that people are presumed to be heterosexual. Heteronormativity supports negative stereotypes about homosexuality, which, such as a lesbian cannot be, quote unquote, a real woman. Now, an important question to ask is, how do we learn gender roles? Is it innate in us, or do we learn them through socialization or some other process? Now, we'll examine a couple different theories, but most contemporary theories hold that gender roles are learned and socially constructed. One of those theories is called cognitive social learning theory. According to this theory, attitudes and behaviors about gender roles are a result of social learning. This theory is derived from behavioral psychology, if you recall that from your general psychology course. And so the emphasis here is on how the consequences of our behaviors shape future behaviors. So in this theory, behaviors that are met with negative consequences will be shaped to conform to what is believed to be a more appropriate behavior. For example, if a girl plays with toy trucks, she may receive negative looks or told that good girls don't play with trucks. Over time, she learns that girls are meant to play with dolls rather than trucks. So in this way, gender roles are shaped by consequences, either reward or punishment. So how are thoughts involved with this? Cognitive processes involved in social learning include the use of language. So a parent can simply tell a child how to behave that will translate into gendered behaviors. It can also include anticipating consequences of gender nonconforming behaviors. Children from a fairly young age can perspective take and anticipate negative reactions for wearing clothes typically associated with the other gender. Finally, children have eyes and can observe how other people behave. That is, what they wear, how they speak, their mannerisms. Observing others, called modeling, will influence our own behaviors. But cognitive social learning theory isn't the only theory for how we might learn gender roles. According to cognitive development theory, children actively interpret the messages they receive from the environment. In this theory, developed by Kohlberg, children learn differently than adults, and that changes with age. There are three stages according to Kohlberg. First, in the gender identity state, the child recognizes that they are either a boy or a girl and have the ability to label others as a boy or girl. In the gender stability stage, the child starts to believe that the identity in which they recognize themselves as does not change. And finally, around 6 or 7, the child accepts that gender roles do not change regardless of changing appearance, activities, and traits. This is gender consistency stage. Now, other theories of gender role learning emphasize less individualistic factors. For example, in social construction theory, gender is seen as a set of practices and performances that occur through language and a political system. And similarly, queer theory broadly states that gender and sexuality are systems that are not gender neutral and cannot be understood by the actions of heterosexual persons. Here, gender is not seen as fixed and not only vary by individual, but also vary situation to situation. Okay, let's take a closer look at gender role development. One thing that's clear is that learning begins at birth. How think of how we describe babies assigned female at birth compared to babies assigned male at birth. Studies show that girls are defined as soft and small, while boys are strong and bold. Parents are the earliest influences on infants. They teach infants and children how to socialize and sort of be in the world. And for that reason, they are referred to as socializing agents. This socialization process can be overt or subtle and include the following. They can include manipulation. This means that they treat the child differently, such as being gentle with girls or rougher with boys. It also includes directing kids' attention to certain objects or activities that are gender congruent. This is what we call channeling. Another way of socializing children is through verbal appellation, where parents assign different language to children's behaviors. So if a boy is vocal, he might be called assertive or bold, where a girl might be called aggressive and loud. And finally, we guide children towards activities that are gender congruent, that is, called activity exposure. So as you know, all of these ways that we guide children regarding what is considered appropriate or inappropriate gender roles can quickly make it clear what roles we're expected to take. However, parents are not the only socialization agents. For example, teachers in the classroom environment can be important agents for teaching children about gender roles. Just the fact that most daycare and elementary teachers are female sends a message to kids. Recent evidence suggests that teachers rate females as further in their understanding of math and science than males, so gender norms around these are starting to change. Another critical socialization agent are peers or age mates who become especially important when children enter school. Peers influence play activities and toy selection, provide verbal approval or disapproval around gender norms, and model attitudes, behaviors, and beliefs around gender. Perhaps the most clear example of this modeling is around peers' influence about sex and learning about different sexual practices during adolescence. Finally, as we talked about in chapter 1, media has exerts a strong influence on how we see and how we feel about gender and gender roles. So a lot of influences on children to shape and solidify their beliefs around gender roles. You can understand now why unlearning some of these gender roles can be really difficult. All right, so one last slide before we talk about contemporary gender roles. At the highest level, our culture provides a framework, or what we call gender schema, for how we should organize the world according to gender. These schemas often are used to exaggerate differences between females and males, or create differences where few real differences exist. As noted in the last few chapters, female and male orgasm are essentially the same physiological process, but gender schemas exaggerate those differences. These schemas can, for example, make multiple associations between gender and other non-sex linked qualities such as affection and strength. And these gender distinctions form the basis of cultural norms, status, taboos, and privileges, and often may serve to undermine and undervalue the uniqueness of individuals. Okay, so let's talk about contemporary gender roles and scripts. What are the broad shifts in gender roles that we've observed? For one thing, there's been a shift towards more egalitarian gender roles, although women's roles have changed more than men's roles. But men's are also slowly starting to change a bit. Members of conservative religious groups still tend to adhere more strongly to traditional gender roles. So let's spend just a moment thinking about what are traditional gender roles, at least in our society. So for males, traditional gender roles include having the qualities of aggressiveness, emotional toughness, independence, feeling of superiority, and decisiveness. Males are believed to be more power oriented and competitive. In contrast, traditional female gender roles value passivity, compliance, physical attractiveness, and being a partner or wife and mother. Females' work roles are viewed as being subordinated to their marital and family roles. Now, these ideas about gender roles form what we call gender-based scripts. Gender roles are more general behaviors, but scripts really get into the weeds about what specific behaviors and rules should be followed, and what are the specific expectations for that role. So scripts are really where the rubber hits the road. So here you see typical sex scripts for men and women. Men should not have or express certain feelings. Their performance is what counts. He is in charge. He should always want sex and be ready for it. All physical contact leads to sex for him. Sex should equate to intercourse, and sexual intercourse always leads to orgasm. For women, sex should be seen as both good and bad. They are taught that it's not okay to touch themselves, quote unquote, down there, and that sex is for men, but men should know what women want, and women shouldn't talk about sex, but they should look like models, but be nurturing too. And there's only one right way to have an orgasm. So that's a lot of pressure for both sides. So what about other notions of gender roles? Contemporary gender roles often display traditional elements along with egalitarian and androgynous ones. These contemporary sexual scripts for both sexes often include the following elements: that sexual expression is positive and healthy, sexual activities involve a mutual exchange of erotic pleasure, sexuality is equally involving and both partners are equally responsible, sexual activities are not limited to penetrative sex but include a wide variety of sexual expression. Sexual activities may be initiated by either partner and should always be consensual, and both partners have the freedom to accept sexual pleasure and experience orgasm. Okay, we'll spend the rest of this lecture examining different aspects of gender diversity. Research suggests that gender should be represented by multiple categories that are not mutually exclusive. So, in other words, one can identify as more than one gender, and also that gender is fluid, that is, that identity can change over time. Terms such as androgynous, genderqueer, and gender fluid are used to describe the variations that exist on the gender spectrum. By androgyny, we mean when somebody has a combination of masculine and feminine traits or a non-traditional gender expression. So as of 2019, the World Health Organization no longer categorizes having a transgender identity as a mental disorder. Now, transgender communities have faced a great deal of attention lately, with strong feelings expressed in support of and against them. One of the reasons that some people may have strong negative views of the transgender community is because the community challenges our ideas of the gender binary and of gender identity. As we discussed earlier, gender roles are learned from a very early age and become an integral part of who we are. So a challenge to conventional ideas about gender and gender roles can feel threatening to some people. It's also important to point out that, like cisgender individuals, transgender and non-binary individuals experience any type of sexual orientation, including gay, straight, or pansexual, to name a few. Again, it's important to separate gender from sexual orientation. An important topic is to understand issues around transgender youth. As with adults, the number of children identifying as transgender is growing. Like adults, these individuals feel a strong conflict between their gender and their physical sex characteristics. Remember that gender identity and social norms around gender identity form at an early age, so even relatively young children can experience this conflict. But how do we approach the best psychological and medical care for transgender youth? That's a question that has become quite divisive in our society. But there is a more consensus in terms of how we care for transgender youth in the medical community, as we'll discuss. So, over time, a variety of theories and approaches relating to gender development and standards of care for gender nonconforming children and youth have emerged. Gender-affirming care is a supportive form of health care consisting of medical, surgical, mental, and non-medical care for transgender and non-binary people. There's a lot of confusing messages right now about gender-affirming care for adolescents and children, so let's talk about it a bit. Importantly, the American Medical Association, the American Pediatric Association, and the American Academy of Pediatrics all endorse gender-affirming care for adolescents. If appropriate, the adolescent and family can determine the best way to socially transition in which the adolescent starts to live as their gender. Now, medical guidelines recommend against children under 18 undergoing genital surgery. Instead, many clinics and health professionals use the watchful waiting approach in helping gender-diverse children. In cases where the child is insistent, persistent, and consistent in expressing a gender than the gender they are assigned at birth, only then is their family encouraged to decide along with the child when to socially transition. Now, in some cases, youth may be prescribed gonadotropin-releasing hormone antagonists that will suppress puberty and allow the youth more time to explore their identity. Importantly, this is reversible and gives a little bit more time for the youth and the family to explore before permanent physical changes can occur. But again, this is a decision that is made with the family and the young person. Now, as many of you know, gender affirming care has become a really hot topic. The fact that we're talking about children and adolescents brings a lot of strong feelings, which is understandable. But it's important to know that no decisions about gender affirming care are being made without the family consent and the consent of the youth. So no one is going to school one day and be coming home as a different gender. It's important to get accurate facts about this important topic. Now, an important aspect in a psychology course is to understand diagnoses that are related to gender. One of those is gender dysphoria, which is a diagnosis where there is a marked incongruence between one's experienced, expressed gender and assigned sex, sometimes called natal gender, of at least 6 months duration, and also where the condition is associated with clinically significant distress or impairment in social, school, or other important aspects of functioning. So it's not only that there is an incongruence between sex assigned at birth and a person's gender, but it has to be associated with clinically significant distress and reduced functioning. So notice that this is not the same as being transgender. Transgender persons feel incongruence between their gender identity and sex assigned at birth, and they may or may not experience clinically significant distress or impairment. There are separate criteria for children and adolescents and adults to be diagnosed with gender dysphoria, but these two features of gender dysphoria remain consistent. A few other important points to make about gender dysphoria. First, many people with gender dysphoria may eventually live as their desired gender and may seek gender confirming treatment or gender assignment surgery, which can allow individuals to replace, for example, a penis with a clitoris and a scrotum for a vagina. Furthermore, in the wording of the criteria, the other sex is replaced by some alternative gender because the concept of sex is inadequate when referring to individuals with a difference in sex development, which we'll discuss next. Okay, so I just mentioned the differences in sex development. So what is this? A difference of sex development, or DSD, is a medical diagnosis used to describe a group of congenital conditions in which the external appearance of the individual does not coincide with a chromosomal constitution or gonadal sex. So importantly, gender identity and differences of sex development are on different continuums and should not be confused. These conditions used to be referred to as disorders of sex development, but are increasingly recognized as natural development variations. So let's talk about those. So intersex traits is an umbrella term for differences in sex traits or reproductive anatomy resulting in a discrepancy between the external genitals and the internal genitals. Intersex can be divided into four categories. The first two are shown here. 46XX is where a person has the chromosomes of a woman, the ovaries of a woman, but the external genitals that appear male. 46XY intersex is where a person has the chromosomes of a man, but but the external genitals are completely formed, ambiguous, or female, while the internal testes are normal, malformed, or absent. The third and fourth intersex categories are shown here. Supragonadal intersex is where the person has both ovarian and testicular tissue, which may be in the same gonad, or the person may have one ovary and one testis. The person may have XX, XY, or both chromosomes. Finally, complex or undetermined intersex differences of sexual development is where a person may have many chromosome configurations that can result in differences in sex development, but these do not result in a condition in which there is a discrepancy between internal and external genitalia. Now, some DSDs are the result of erroneous chromosomal patterns. Two of these are Turner syndromes and Klinefelter syndrome. Turner syndrome is a genetic condition in which a female does not have the usual pair of two X chromosomes. Rather, the female has one X chromosome and one missing X chromosome. Hence, sometimes this is called 45XO. Turner syndrome is common, occurring in 1 in 2,500 live newborn girls worldwide. Persons who have this are usually short in stature, have thyroid issues, can have a wide and webbed neck, small breasts, heart abnormalities, kidney malformations, and will not have fully developed ovaries, and will not menstruate. Hormone replacement therapy can be administered to promote secondary sex characteristics, but the person usually remains infertile. Klinefelter syndrome is when males have one or more extra X chromosome. It is also fairly common, occurring in 1 in 500 to 1,000 newborn boys. Because of the extra X chromosome, it is sometimes referred to as 47XXY. The presence of the extra X chromosome interferes with male sexual development. Okay, so here you can see are some of the characteristics of Turner syndrome. So they include things like short stature, drooping eyelids and dry eyes, thyroid problems, minimal breasts, extra folds of skin, heart abnormalities, undeveloped ovaries, swollen hands, and so forth. And here are the characteristics with somebody with Klinefelters. So that can include tall stature, lack of facial hair, tendency to lose chest hairs, some breast development, short trunk, osteoporosis, female type pubic hair pattern, undersized penis, small or and firm testicles, long legs, and a slightly feminized physique. All right. Differences of sex development may occur for reasons other than chromosomal abnormalities. Prenatal hormone abnormalities may also cause the development of physical characteristics typically associated with the other sex. We'll discuss three of these. First, androgen insensitivity syndrome is when a person is genetically male but is resistant to male hormones or androgens. This can prevent the development of the penis and other parts associated with being male. So a person with complete androgen insensitivity syndrome may appear to be female but has no uterus. But other persons who have partial androgen insensitivity may have some male and some female traits. Another prenatal hormonal anomaly is congenital adrenal hyperplasia. This is a group of inherited disorders of the adrenal glands that can affect both boys and girls. Persons with this lack persons with this lack an enzyme needed by the adrenal gland to make the hormones cortisol and aldosterone. But the body continues to produce androgens, which is a type of male sex hormone. So persons with this may be genetically female and have ovaries and a vagina, but appear externally male. Treatment includes taking cortisol to replace the cortisol that is not being produced in the adrenal gland. And finally, 5-alpha reductase deficiency is a condition whereby a genetic male will not produce enough of a hormone called dihydrotestosterone, or DHT. Since DHT is important to the development of external sex organs, someone who is genetically male may be born with female external genitals. This is much rarer than the other disorders or differences of sex development that we discussed. Okay, to end this presentation, let's consider society's reactions to gender diversity and best practices for supporting gender diversity. First, it's important to recognize that most societies have a difficult time with differences. These topics are difficult and bring up a lot of feelings, but they're important to discuss. However, feelings of rejection and loss are common concerns for those facing gender transition, and some feel their only choice is transition or unfortunately suicide. Most professionals agree that the more we educate ourselves and talk about these issues, the easier it can get. The issue of how to handle gender in schools is fraught with differences in how it should be handled. But in 2021, the U.S. Department of Education released guidelines to help provide educators the information they need to ensure that all students learn in a safe and supporting setting that's free from discrimination based on sex. And this included sexual orientation and gender identity. So, to this end, schools were then required to provide a safe space for everyone, including LGBTQ plus persons and allied students. This also applies to colleges and universities who have to adhere to Title IX, which is an educational amendment that protects people from sex discrimination in programs or activities that receive federal financial assistance. So Title IX stipulates that sex discrimination prohibition extends to claims of discrimination based on gender identity or failure to conform to stereotypical notions of masculinity or femininity. In addition, the Supreme Court in 2020 ruled that those who identify as LGBTQ plus can no longer be dismissed from employment because of their sex or gender. So some protections for respecting a wide variety of genders have been implemented in the past few years. Now, whether those protections remain in the future may depend on how much people are aware of and have accurate knowledge of the complex issues around gender and gender identity. And that is the end of this lecture.